Hello everyone, thank you for stopping by today to take a look at my presentation, review my case studies, and see my poster. I greatly appreciate y'all taking that time out of your day. My name is Jason Ayers. I'm an RN, wound care nurse. I work in the acute care setting. I am from Crossville, Tennessee. I am pleased to be joined today with my two co-authors on this study, Dr. David Haverly, MPD, podiatrist, surgeon, medical director, and friend. I am also very pleased to be joined with Josie Smith, my daughter. She is an RN, BSN, and she also is currently working toward her master's degree in nursing. Today we're excited to present our poster to you. A clean wound is a healing wound. Case studies using a disposable whirlpool hydrotherapy setup for reduced pain and wound debridement, powered by and combined with topical oxygen. Our challenge and clinical problem we sought to solve, as the title says, a clean wound is a healing wound, to be able to get it to that stasis. Cleansing debridement of diabetic foot ulcers, peripheral arterial disease ulcers, pressure ulcers, and stasis ulcers are often painful, time-consuming, and difficult for most nursing to complete. Slough biofilm, thick eschar can slow healing down dramatically. Causes prolonged infection risks, etc. We had looked at traditional therapies such as traditional hydrotherapy. Traditional hydrotherapy has been considered outdated. Many issues was found with it, being cross-contamination, difficult setup time, solution mixtures, etc. However, it was clinically shown and proven to be highly effective in removing slough, eschar, debriding wounds as well, with reduced pain. We sought to try to find a way to use those benefits and bring those benefits back more active into the practice. We combined and developed a kit using a mixing kit, a bubbling device, and a cleansing pad all together. We combined the hydrotherapy with oxygen gases in order to be able to power it without using any electrical setup. Our oxygen powered device uses a small self-adhesive bubbler that sticks to any container or plastic liner that can be put down into a container. It creates a gentle whirlpool effect with thousands of tiny oxygen-rich bubbles that will pass directly over the wound or limb in the solution. Typically, I highly recommend an antiseptic solution be used with this process. We typically use quarter strength Dakins, acetic acid, betadine, or others. In our case studies, we'd like to highlight for you today. We had one case study with an 89-year-old diabetic male with calloused eschar on the great toe. He had a thick, foul-smelling eschar, had pus coming from around the edges of it. We chose to treat him with a 15-minute treatment with the oxygen-powered hydrotherapy. It was able to soften the eschar that during cleansing was able to peel away the large cap cover in it, exposing red and yellow wound base that was able to greatly expedite healing for this individual. Our second case study I'd like to share with you was also a diabetic patient with peripheral arterial disease. Stepped on a toothpick several days prior, delayed seeking medical attention, area inflamed and became infected. Our surgeon was able to cut down the side of the foot, opening up the area and draining the pus that was involved. The injury due to his severe peripheral arterial disease, encircled with purple, dark purple tissue discoloration, cyanotic in appearance. We did one treatment for about 20 minutes with the oxygen and acetic acid. Immediately after, there was notable difference seen within the photographs in just 20 minutes. The dusky colored large toe, great toe, became more pink, and we saw a regression of the purple cyanotic tissue, exposing red and pink around the peri-wound area. Other case study we've shared on this poster was a homeless patient with multiple foot ulcers, frostbite history, maggot infestation, dried blood and feces. Patient was found left alone with poor care. After one 15-minute betadine hydrotherapy session, heavy crestin and biofilm left it away from the ulcers, exposing pink wounds or tissue underneath. Great cleansing effect. Patient was very excited to see the effects after having his spa day treatment. He referred to it and said, "My feet haven't looked this good in years," in a very country accent. Another case study also presented on this poster was a critically ill diabetic Charcot foot patient. We had an ICU. He was found to be too unstable for a trip to the ER. However, on assessment, we found a large Charcot foot ulcer, large amount of eschar, slough, biofilm, strong odor present on the wound. We did a treatment on him with Dakins with a balloon about 15 minutes, greatly reducing the odor to the wound. The pus and the slough was all coming off. Patient improved significantly. We were able to do a minor bedside debridement versus taking him to the OR and anesthesia, and within the week was able to instigate a wound vac to promote further healing. In every case that we presented here and that we've been experiencing, we have seen rapid softening and removal of slough, eschar, and biofilm, visible improvement in tissue color and perfusion, significant pain reduction during debridement, faster progression to other advanced therapies such as negative pressure wound therapy, placing a vac. This disposable oxygen-powered whirlpool system makes effective hydrotherapy and topical oxygen practical across the entire continuum of care for us at our hospital, all the way from ICU to home. It's been very staff-friendly, patient-friendly, very cost-effective, very affordable to assemble. Final takeaway message: a clean wound is truly a healing wound. To be able to clean away the slough, the debris, and the eschar can greatly accelerate the wound healing, and this has been a fantastic tool in our practice, and we would like to share it with you all. For more information, please contact me with your questions. I have other case studies I'd be happy to share and review with you. My email address is woundcarewithjason@gmail.com. I hope you found this useful for your practice. Please contact me again for any information you need. Thank you.